Okay, so welcome everybody to our presentation tonight. We are UPMC Centers for Rehab Services. So we offer outpatient physical, occupational, and speech therapy. Our guest speaker is Susan George. But first I would like to talk a little bit about a notice. We just want to let everyone know that we are recording this for educational purposes. And just as a disclaimer that this presentation is not intended as a formal diagnostic or treatment for the conditions that we discuss. So if you do have symptoms or concerns related to what we're talking about today, please consult with our therapist on this call or your medical professional. And today's topic is Getting Your Core On with Susan George. She is the director of our Women's in Rehab Men's Health Program. So without further ado, we'll let Susan take over.
Lovely. Great. Thank you so much for having me tonight. This is one of my favorite topics because, go ahead and can you go to the next slide? Because the question really is, who needs a better core? And the answer is, we all do. With very little exception, we all could work on our core and make it stronger. So whether you are a survivor, or whether you are the family member of a survivor, or whether you're the person walking down the street, or whether you're the person jogging down the street, we all could benefit from a strong core. And the reason why is because when your core muscles are weak, it leads to low back pain, to shoulder and neck pain, especially when you're lifting things, carrying, overhead reaching. It leads to pain in your hip and your pelvis and also your knee. It leads to ankle pain and difficulty standing on one leg and moving in bed, and it makes you tired. Next slide, please. So the question really is, we hear that we want strong abs. And the question is, what really do we want? Do we want core strength? So do we just want brute force in our core abdominal muscles? Or instead, do we want core stability? And that's the ability to resist unwanted movements by being able to stiffen your spine and maintaining your balance without falling over, which I think is a pretty good thing to be able to attain. Next question, or next slide, thanks. Core stability, what we really want is dynamic control. And the reason why is because when you have dynamic control, those little teeny bones that are stacked up on each other that make up your spine are stable, and they move then in the proper coordinated manner, which reduces your low back pain. So when your vertebrae are stabilized, it allows you to move more freely in your back with less pain. It also provides a base from which you can lift up your arms, you can carry groceries, pick up kids, and throw balls, because the shoulder blade needs to act as a stabilizer on a stable trunk to even allow you to pick up your arms. And then also core stability allows you to stabilize your hips for walking, standing, sitting, exercising, all of those things. So your core is really so much more than a six-pack made up of or created by crunches. So what creates core stability? So this triangle here represents, at the very top, you have your diaphragm. So I basically am looking at your core three different ways. You've got your diaphragm on the top, that's the roof of your canister. So here's your canister or your can of Coke or whatever you like to drink. For me, I like seltzer water. So this is the top, the snap top. And then at the very bottom of the can, you have your pelvic floor muscles. So we're mostly talking about the core today, and your pelvic floor muscles are actually a part of your core. They're at the bottom of the box down here. Think about it. If you pile a bunch of books in a box and you pick up the box around the sides and the books are too heavy for the books are going to fall out of the box. So your pelvic floor muscles are the bottom of the box that provide that really solid stability when you are lifting and moving and breathing and living normal life. So it's really important to have strong pelvic floor muscles. And then in the front of your belly, you certainly do have your six-pack, but underneath your six-pack right here is the transverse abdominis muscle. Very important to help stabilize the trunk. And so that's this front wall here. And then you've got the multifidus muscles, and they're teeny weeny itsy bitsy muscles that join the vertebrae of the spine together and add that stability. So these are the components of the core, and we're going to talk further about them. Go ahead. So the pelvic floor muscles on the bottom, they act as that bottom support. They also, obviously, as you might guess, provide bowel and bladder continence. So this is the muscle that you strengthen if you don't want to toot in public. And it's also the muscle that you strengthen when you don't want to leak urine when you sneeze, laugh, or cough. And also, it's the muscle that you squeeze if you want to control bladder urgency, which makes you run to the bathroom quickly. It also happens to be the muscle that squeezes during orgasm, so it helps to strengthen your pelvic muscles to increase your orgasmic response. So the second muscle we talked about is the deepest muscle of your abdomen. I didn't type very effectively there. It shouldn't say deepest pelvic floor muscle. It should say deepest abdominal muscle. So the abdominal wall, deepest muscle. It acts as a corset or girdle to support the spine. And the more you strengthen your transverse abdominis muscle, it actually flattens your abdomen and narrows your waistline. So my patients like coming to PT when I give them the transverse abdominis muscle to exercise, because as that muscle gets stronger, they notice a more definitive waistline and they look slimmer. So they're pretty compliant with my exercise program. So the multifidus muscles, the teeny weeny muscles that stabilize the individual vertebrae, work with the transverse abdominis to provide that overall general core muscle activation. And we really don't hear a lot about the transverse abdominis or the multifidus muscles. We often hear about the ab muscles from the rectus abdominis, which makes up your six-pack, to the obliques. And we know that we can do sit-ups and we can do diagonal sit-ups, and that works on those three groups of muscles. And we don't often hear about the multifidi, and more so we hear about those really big paraspinal muscles on either side. But the trick here is that these four muscles listed are really the basic core muscles upon which you can move with grace, with ease, with less pain, and with greater skill. So the last muscle you don't really think of as providing stability, but the diaphragm controls how much pressure is in the abdomen. So when you fill your lungs with air, the diaphragm descends. It creates more pressure in the abdomen, and it actually improves your core stability. So all of these muscles work together to achieve your goals. Go ahead, next one. And so the question is your goal to strengthen your core? And if it is, then right now is the time to regroup, refocus, and rebuild your core. And the way you do that is one building block at a time. So let's talk about that. Core stability, your pelvic floor muscles. So how do we strengthen your pelvic floor muscles? Nobody has to do this that's watching this, whether you're watching it right now or whether you are in the future watching this Zoom meeting. You don't have to participate in this, but let me explain to you how you actually would tighten your pelvic floor muscles. because you do want a strong bottom of the box. You'll see in the kind of red rust color right here, this is where the pelvic floor muscle is, also called the levator ani muscle. And right here, and that's in men, and this is the muscle in the rust color in the female patient. And so this muscle goes from your pubic bone in the front to the tailbone in your back. And it has an opening for urine to come out and an opening for stool to pass as well. And these muscles are tightened by thinking, how would you prevent loss of gas, or how would you prevent loss of urine? And when these muscles work properly, you actually feel them lift up and in. And the goal is working on holding these muscles while you're breathing in and out. So you don't want to squeeze these muscles and hold your breath. You want to actually tighten your pelvic floor muscles as if you were preventing gas from leaking out. And you do that at the same time you're breathing in and out. If we hold our breath with these exercises, it jacks up your blood pressure, and nobody wants that to happen. Next slide, please. The transverse abdominis. If you find the bones in the front of your pelvis, there are two bones, kind of sharp bones on either side. If you put your fingers on those bones, and then you can, just inside those bones is where you can feel these transverse abdominis muscles work the best. And so what you do is then you think about pulling your lower abdomen toward your spine. I don't want you to pull your upper abdomen toward your spine. Let's stick to focusing on your lower abdomen below your belly button. So what are the common mistakes? The common mistakes are that you turn on and activate your six-pack instead of your transverse abdominis muscle. Also, some people tend to push down, thinking that that's the best way to squeeze these muscles. And other people pooch their belly out, thinking that's how to squeeze these transverse abdominis muscles. But in fact, you want to put your fingers inside your front pelvic bones and actually feel right there in that spot while you pull your lower belly to your spine, and you'll feel those muscles squeeze. It's not a big movement. It's not a big muscle, so it's a teeny bit of a movement. The next slide, please. So the multifidus muscles are a little bit harder to feel whether or not you're activating them. So usually what I tell people is, if they're able to, lie on your stomach with 1 to 2 pillows under your belly. That puts you in a little bit of a flexed posture because these muscles tighten as you move into an arched back position. So think, first of all, about lifting your leg. Don't actually lift it, but think about lifting it, and you'll feel a tightening right down in your low back. Then go ahead and very, very slowly lift your thigh 2 inches from the ground, and then lower it slowly. Sometimes these deep stabilizer muscles in your back don't automatically turn on because they've been injured during a back injury. And so they kind of turn off if there's a back injury, if you've pulled your muscles, if you've got muscle spasm. So sometimes we especially need to teach these muscles to turn back on. So say you're like, I can't lay on my stomach. What can you do? You can sit in a chair, slouch around your low back, and then think about tightening the muscles in your low back while you're arching your back a little. So there are multiple ways. The next exercise, oops, can we go back one? The next exercise is your diaphragm. And what you do is you put a hand on your chest and a hand on your belly, and you breathe into the belly so that your belly hand moves more than your chest hand. So you shouldn't be breathing in like this, lifting your shoulders. It should be a nice deep breath where you feel your belly expanding outward. You should also, though, feel your ribs go out to the side as well. So in order for the diaphragm to expand fully, we like to see the ribs come out and the diaphragm actually go down. And that helps to increase that core inner pressure when you're activating these other muscles. Go ahead, next slide, please. So core stability, how do you get it? You get it by starting to activate each of these muscles individually. Make sure you're breathing, coordinate breathing with these muscles. Hold the muscles maybe 5 seconds, then do 5 of them, and progress the whole time as you're able to and you feel comfortable doing so. And this information, just so you know, you'll find this on the internet. If you ask these same questions, you're going to find the same information on the internet. So know that this is not so much really high-tech physical therapy education, but this is a basic understanding of how to use all of these muscles that you can also find out more information on the internet, or you can come visit us and we can help you, or you can ask questions during the presentation today. The next thing you can do is combine that transverse abdominis muscle with the multifidus muscles in the pelvic floor and practice the breathing in and out. And then you can practice this combined muscle exercise when you're laying down, when you're sitting, when you're standing, and with functional movements. And then you can move on to higher level core exercises. How do you know when you're able to progress your exercises? It's when you can breathe easily through the exercises. If you've got to hold your breath, you're doing too much. And the control, can you control how you're performing your exercises? And then also it's the form. If your face is turning purple because you're holding your breath and you're having to bend forward to do an exercise, then I think it's safe to say that exercise is too advanced for you. Next slide. Okay, exercise form. When you are moving on and you get the idea of how to stabilize your core by stiffening your spine using your transverse abdominis, your diaphragm, your pelvic floor, and your multifidi, after that, you can go ahead and maybe add some weights to the exercise. So you can add some arm weights, some leg weights, those kinds of things. But again, you have to make sure that you're activating the core slowly and intentionally, and you maintain the correct posture. Next slide. So you can look these up on the internet. Higher level common core exercises that a lot of people enjoy are planks. You can do prone planks. You can start with them on your knees and on your elbows. You can move to side planks where your knees are bent. And then you can go ahead and progress to legs straight. Dead bug exercises are great because you do them on your back and it's a coordinated pattern of moving your arms while you hold your core tight. And then you can move your legs and then you combine the two movements. Think of what a dead bug looks like. A dead bug has their legs pointed up to the sky. And so that's the beginning of progression of these, the progression of dead bug core exercises. And then bird dogs, you're on your hands and knees and you pick up one arm and then eventually maybe you'll pick up an arm and a leg. And the key for all of these exercises is you shouldn't progress to the next level unless you're able to maintain a stiff trunk and you're able to maintain the form, breathe through the exercises, all of those components still come into play. Next slide. So adding weights and expanding exercises. Look at the person on the left and you'll see in order for her to bend her arm to use these weights, she's got to arch her back. So she does not have good control of her core when she's lifting the weights. Now the picture on the right, she's gone down a few pounds in weight, and she can hold herself in nice alignment and still do the weighted exercises. So the other thing you'll see people do when they're exercising with free weights, and that's what these are, when you're holding weights, they're called free weights. What you'll find also happens is that people kind of bend over and they pull up their arm, they kind of get momentum going. That's really not the way we want to progress weights. The way we want to progress weights is to maintain that good form and intentionally do the work of lifting, not just using momentum. Although certainly you can lift heavier weights that way, it's unfortunately a way that would increase your risk of injury. Next slide. So now let's just expand our horizons a little more. We talked about the diaphragm at the top, the pelvic floor at the bottom, the multifidus in the back, and the abdominals in the front. And what we want to then do is add these other muscles that are so important. We know that of course we need a strong rectus abdominis, and we need strong internal and external obliques in the abdominal wall as well. A really important time for this to occur is if any of you have been pregnant, then these muscles get stretched during progression of pregnancy. And so it's very, very important that we make sure that these muscles have appropriate tone. This can also happen as weight gain occurs in the abdomen, or if fluid is collected in the abdomen, we stretch out those abdominal muscles, and then we have to go back as we regain control of abdominal contents. Then you go back and you work on strengthening those muscles. So the two extra muscle groups that we hadn't talked about that I still think are so important to core stability are hip muscles and also the scapular stabilizers in the shoulder. So let's go ahead and talk about those. So the core muscles of the hip, the two muscles that I really want to emphasize that you need to check out to make sure they're strong are your gluteus maximus muscles. Do you ever see somebody that they can't keep their pants up because they don't have much muscle mass in their buttock area? These are people that really could use a little bit core strengthening of their hip. And I think of this as hip core strengthening of the glute max. And I just tell people, think about pinching your crack together and put your hands on your bum and make sure that the contraction is happening at the gluteus maximus and not just at your hamstrings. So that's one exercise. And then the gluteus medius is the muscle on the side of the hip. And that muscle is really important to strengthen as well. So if you stand on one leg and this gluteus medius is not strong, you'll find that your other hip actually sags. And so strengthening these muscles is super important if you find that they are also weak. Because if you have weak muscles in the glute max and glute medius, it puts you also, especially the glute max, it puts you at risk for actually having the head of the femur move forward in the socket, and then you have impingement in the front of your hip joint. Strong muscles reduce the risk for developing impingement in your hip joint. Let's talk about the shoulder. So the most important thing with lifting the arm is the shoulder blade, right in this area here, is the shoulder blade stabilized by all of these lovely muscles around it. So you've got the arrow that comes down to the right. You've got the lower trapezius muscle, and that allows the shoulder blade to stay put while you elevate your arm. And if you don't have a strong lower trapezius, strong rhomboids, strong latissimus dorsi muscles, then the shoulder blade kind of wiggles around, and when you try to lift your arm, you develop a tendonitis sometimes in your rotator cuff because they have to work so hard to try to control movement. So you need really great scapular control or shoulder blade control. And some of the muscles that I find we don't exercise enough are the lower traps and the latissimus dorsi. And that helps you to just more easily raise your hand over your head. Next slide. So I guess the question for each of us is, what are your next steps? And then also, how can we help you? We're here to help. We are UPMC Centers for Rehab Services. The particular program that I'm the director of is called Women's Rehab and Men's Health. And one of the interesting niches of patient care that we have embraced is doing a better job at taking care of men and women and children in some cases who are oncology survivors, or cancer survivors, and maybe they have had breast cancer, which makes their shoulder a little bit weak. And we help you address shoulder issues, and we help you address tight scars and pain where your port was and where your drains were. We also help you if you have gynecologic cancers, make those muscles stronger so that you have less issue with leaking urine, leaking stool, and then also pain management. So thank you so much for your time. I appreciate it. Anything else? Any questions?
Do you want to